Arteriosclerosis obliterans and thromboangitis obliterans are two vascular conditions that impact the blood vessels, leading to reduced blood flow and a variety of symptoms. There are, however, key differences between their etiology, the vessels affected, the population at risk, and the treatment. Not to mention, this is a very common pathology exam question. Arteriosclerosis obliterans is a condition characterized by the thickening, hardening, and narrowing of the arteries, primarily due to the buildup of atherosclerotic plaque. Thromboangitis obliterans is an inflammatory condition affecting small and medium-sized arteries and veins, usually of the extremities. So arteriosclerosis is not an inflammatory condition. The cause of arteriosclerosis obliterans is atherosclerosis, which again is the buildup of fat and plaque in the arterial walls. Thromboangitis is peculiar because the exact cause is not really known, but there is a strong association with tobacco use. The vessels affected in arteriosclerosis are usually large and medium-sized arteries of the lower extremities. Those in thromboangitis, on the other hand, are small and medium-sized arteries and veins, usually of the hands and the feet. Arteriosclerosis typically affects older adults, especially those with risk factors of smoking, diabetes, hypertension, and high cholesterol, whereas thromboangitis typically affects young male smokers under the age of 40. The symptoms of arteriosclerosis are typically intermittent claudication, which is pain in the legs while walking, but there can also be rest pain as well as the presence of ulcers and gangrene. Thromboangitis has the same symptoms, but in addition, Raynaud's phenomenon is more common in thromboangitis. Raynaud's phenomenon is the darkening of fingers and toes when the patient is exposed to cold temperature. Arteriosclerosis is diagnosed through PE, through the ankle brachial index test, Doppler ultrasound, and angiography. The same is true for thromboangitis obliterans. The treatment for arteriosclerosis is the institution of lifestyle changes. We can pursue medications to help increase blood flow, namely antiplatelets, statins, and antihypertensives, and in severe cases, even surgical interventions. The treatment is generally the same for thromboangitis, with, of course, the increased emphasis in the cessation of tobacco use. The prognosis of arteriosclerosis is extremely variable, depending on the extent of disease and the success of treatment. And the same is true with thromboangitis, with the increased caveat that if the patient does not cease tobacco smoking, the prognosis will continue to get worse, eventually leading to severe complications.